Yes, this is a meeting for information waiver, and I am the crisis specialist here, but we have a lot of case managers present, as well as other program managers and Imagine staff. Excellent. Okay, well then I will get started. Thank you everyone for coming to our first informational session about the DD waiver. We are hoping to go over all of the essential pieces of the waiver and answer a lot of questions through the presentation, but whatever we don't hit on, we can discuss in the questions section. And anything that we don't know, we will get an answer and bring it to you at a later time. All right, let's get started. All right, and then perfect. Here we go. So what is the DD waiver? So it will often be abbreviated as DD. It's sometimes you will see it written as HCBS DD, which stands for Home and Community-Based Services. And the DD stands for Developmental Disabilities. So that is a long form name of the waiver. Most commonly, you're going to hear it as the DD waiver. So it is a Medicaid waiver program that offers 24/7 access to supervision and staff through a residential provider. It also still maintains access to day program and other waiver supports that you will find on waivers such as the SLS waiver. So the added component is the residential piece. Individuals will work with different agencies, and we call those PASAs, which stands for Pre-Approved Service Agency, and that's just a different agency that manages the actual residential service. And support is provided to these folks on an annual basis that is written into a plan. If you or your family member is on a current waiver, you've probably heard it called the IP meeting, and that is the time every year when we write up a plan to discuss what we anticipate the individual in service needing for the year. So it's just our projected plan that we revise as needed. All right. So what does residential services entail? So we've collected a list of the general areas that a residential provider would be assisting with. So one would be ensuring the client's health and safety as well as their well-being, personal care, household services, support with communicating with their team or other providers that they work with on the waiver, money management, decision-making, those are all supports that would be provided. In money management, sometimes that looks like a rep payee who would assist with managing Social Security and making those reports to the county to maintain eligibility. Sometimes that service is done by a family member, a guardian, or a family friend, and they would be allowed to continue to maintain their status as rep payee. It's just offered by a residential agency. So they don't have to do it. The individual may maintain that themselves or whoever is already doing it. It's just something that's available as a wraparound service. They also follow up with different services and work closely with behavior teams to ensure that the client is their needs are being met in the best way. And if they have a behavior plan, just ensuring that the participant is able to follow that and all staff is aware and on board with that. They also assist with appointments, ensuring that the individual has their yearly physical. If there are any medical orders or recommendations from doctors, they ensure that those are being followed or that the individual has access to what they need to keep up with those expectations. Assistance with emergency training for staff is provided through a residential agency, as well as access to the community, sometimes transportation, like to and from appointments. That's a service that's also offered through the waiver, but they could help fill in needs where that transportation wasn't covered. And then any and all supervision needs are also covered through the residential agency. All right, I'm going to slow down a little bit because I feel like I am talking very fast. Okay, so there are a few different kinds of residential models that an individual or family has access to if they choose to accept the DD waiver. The first one is a host home. So that is a community member that is offering their home as a place to receive services. So that may look like an individual, a single person is a host home provider, or potentially a married couple, or a family with young children or adult children. Really any family structure that you see in the community could be a potential host home. And they're opening up a room in their home or several, because you could either be an individual and the only person in services in a host home, or maybe you have some peers that are also living there. We generally see 1 to 3 participants in a single host home, no more than that, just because that's a lot of people to be living in one house. So we're really just going to see 1 to 3, and it comes down to what is the best fit. So if an individual loves being part of a family system, being around children or having peers, they would have the option to look at families that have maybe a lot going on. They like to maintain a busy life. They also have the opportunity to say, I really just like to live with one other person. I like a quieter home. I like to be with someone who feels like more like a peer than a caretaker. They can look like a lot of different ways, but the key part of this one is that the host home provider is not already part of the individual's family. So this would be a community member, maybe someone they know already in the community, but just not someone they are already living with that they are related to. The next one is called a group home. And so that is a home that is generally owned by an agency that has between 4 and 8 individuals living there, and they have access to 24 hours of awake staff. So the staff does not live there. They are rotating to ensure that there's always an awake individual or 2 that are in the home to provide services. In a host home, you would see more, everyone goes to sleep at night, right? Just like your family. So they would be available if something came up overnight, but there's not always going to be someone awake at all times. Whereas in a group home, we keep awake staff 24/7 because we typically see individuals who have higher medical or behavioral needs in a home where they would really benefit from having 24-hour awake staff. So only the individuals receiving services are actually living there. Everyone else is rotating. The next model is what we call a personal care alternative, or a PCA home. Individuals live in their own residence. So this may be in an apartment they rent or a home they live in with their family that may or may not share with other individuals receiving services. And they have staff that are paid on an hourly basis who are available to provide support as needed. There's not a live-in staff member in the home. So it's more so supervision or assistance is provided on an as-needed basis that is probably on a set schedule, or it is just purely based on when a need occurs. So the individuals living in the home are not necessarily employed by the residential agency. And then the final one that we'll be discussing is the family caregiver model. So this is similar to a host home, but this individual is your family member that is providing the service. So it's in your family home, and this is something we see a lot for families that have been providing care to the individual in service their whole lives, maybe. So this is something they've always been doing. They've always lived with their family. And now that they have access to the DD waiver, those caretakers have the opportunity to be paid for this service. And so their family system in the home is not necessarily changing, but now they just have the added support of a residential agency to fill in the gaps if someone were to become ill, if the family went on a vacation and needed respite services, or if something happened overnight, they needed additional assistance. That's when the family caregiver model really thrives. So they would become an employee with an agency, but for the most part, they would continue to provide services as they have, because you know your family member best. All right. So room and board, how do we pay for the DD waiver? So many of the services are covered by Medicaid. The one piece that is not is room and board. And at the highest end, that will be $700 a month. So we most commonly see that paid for through Social Security. Social Security is what covers that first. Individuals can also pay for it with their individual employment if they are working, and that's how they choose to pay for room and board. Maybe they don't receive much in Social Security because of how often they work. It can also be paid for through family if that is something that you'd want to pursue, but we most commonly see it paid for by Social Security. In the family caregiver model, you would be charging the individual, your family member, rent, which probably feels kind of strange because this person's been maybe living with you their whole life and you would never have considered that. But that's why they receive Social Security, is to pay for this need. So you can in turn use that money to benefit them. But we still want to be collecting that rent so they can maintain that rate of Social Security that they're receiving. So that's an important piece that can be discussed in the future. To maintain eligibility for the DD waiver, the same financial criteria applies that it does for SLS. So if you're already on the SLS waiver, this should be kind of a review. So income for the specific individual, if they are working, would need to be less than 3 times the full Social Security amount. And then for just total resources, we want to keep that under $2,000 a month. So that's going to look like the total between their checking account and their savings account. So if you find that you have more money coming in, you've got a lot in savings, it's tipping over that 2,000 mark. Some families address that by spending it down on the person's needs every month. But if you're not able to do that because needs are being met, that's when we'd want to explore something like a trust, because then that wouldn't be included in the resource. So we'd still be able to put away that money for the future to use for this individual as things come up that are not covered by Medicaid, or they want to go on vacation, all the different needs a person may have. We still want that person to have access to the money, but in a way that's not going to risk their financial eligibility. So then we'd be looking at that. So how is the funding different? So if you're on the SLS waiver, you're probably aware that you have a yearly budget based on your support level. So let's say, for example, you are allocated $15,000 for a plan year. You can utilize any services in any amount as long as it is $15,000 or below. So if you can do any combination in there, as long as it is less than that cap. In DD, there's not a financial limit, but there are caps on services. So that will, pardon me, look like a unit cap. A unit is 15 minutes. There are 4 units in an hour. That's just kind of how we code things. But a person on DD can do up to 4 days of day program a week because there's a 4,800 unit cap for the year. So even if they have more funding, they're used to having more funding, that's just the cap for everyone, regardless of their need. Whereas on SLS, if you have room in the plan, you could do 5 days. Because if you can afford it, you can go ahead and surpass that limit. But on DD, there are caps on units. So that's where we see that most commonly. So just deciding what better serves you. If you'd rather be doing 5 days a week and don't need 24/7 access to supervision, DD may not be the best option. And that's something you can discuss with your case manager. Okay, so support levels and funding. So as I mentioned before, you have different funding levels for different support levels on SLS. So what we see in DD is you still are adhering to the support level for funding, and that's funding different hourly rates for different services. It also, so you still have access to all the same services, whether it be day program, supported employment, or residential. It's just the amount that the agency providing it is paid is different based on the needs of the clients. So if they have more needs and therefore may need more assistance from staff, they may be paid at a higher rate. That shouldn't preclude your ability to access services, but there are times like through the pandemic where we did see that support level did affect a person's ability to maintain services. Just if an agency was struggling to meet staffing needs, they might be maintaining folks at a higher support level in order to stay afloat because they couldn't have quite as many folks with lower support levels because it just wasn't financially feasible for them. But for the most part, this should not affect a person's ability to receive supported employment, day program, or residential. You're entitled to all of those. It's up to the agency to decide who they want to work with. Okay, so how are caregivers paid through the DD waiver? So first, if you are doing the family caregiver model, you would be linked up with a residential agency, and they'd be the ones facilitating payment and training. And what it looks like is you're going to be paid a daily rate to care for your family member. So for this, that's when support level comes into play. So it's a different rate, daily rate for every support level. And primarily we see that as a support level between 1 and 6. And then 7 is specifically for individuals that have needs that exceed what we traditionally see for medical or behavioral needs. And that's reviewed on a yearly basis with the state. So that one is treated a little bit differently. Primarily, we focus on 1 to 6 because those are going to be most freely accessible. So the rate is based on the support level, and it is determined by the SIS assessment, which was done when you first entered waiver services. This is something that can be redone if there's a significant change in need. We don't do the assessment yearly. It's something that can be kind of one and done, but we do it again if something has changed significantly in their health. They have a lot more medical needs or behaviorally. So that's when we would want to do a assessment. And if you're ever wondering if your individual may be, it might benefit them, that's when you could talk to your case manager to see if that would meet the criteria for a reassessment. The residential agency supporting you to support your family member takes a portion off the top of that daily rate. And that can be between 20 to 40% of that daily rate. It is up to the agency to decide what they offer. So there's not a baseline for every agency. They're all a little bit different. And it is a rate that you can negotiate. So as we help you to shop around for different agencies, be asking about what their rate is that they take from the daily rate, just for your information, so you can make the decision that is that fits your needs best for your financials. And some families don't worry about that quite as much. And some families, it is a big part of how they are going to be budgeting for the next couple of years. So feel free to negotiate and shop around as it fits your needs. So here are some examples, if you can see this, of daily rates. These are some enhanced, these rates change. We have seen a change during the pandemic. So these could change again as we leave the public health emergency. These are not exact rates. We should just be using these as kind of a ballpark starting point for each level, and do not quote these numbers necessarily. So the residential agency should be able to give you the current daily rates. And then we've also provided with this an example of what the adjusted daily rate might look like depending on how much the agency is taking off the top. So for support level 1, we're seeing a little over $70 a day would be the actual rate coming from Medicaid. And then with the adjustment for 20 to 40% off the top, you might see between $42 and $56 coming to you. Again, a negotiated rate. And then you can see that it goes all the way to level 6, which is $245 a day. So each rate is a bit different, and this is where support level really comes into play, and something that host home providers and group homes might be more interested in a higher rate if that's what they feel that they can support in the home. But there is a provider for everyone. So no, regardless of your rate, we should be able to connect you with an appropriate provider. So then we have a Venn diagram here that shows some of the differences between the SLS and DD waivers. So SLS is in purple, DD is in blue, and we can see that in SLS, you have access to funding for assistive technology, home modifications, homemaker services, mentorship, personal care, personalized emergency response systems, vehicle modifications, respite services. And then on DD, you see the major difference. This is the only waiver that provides a residential service that has access to 24/7 supervision either in-home or in a different setting, and also just support and access to staff at any time. But both waivers, you can access behavioral services, day program, dental and vision, specialized medical equipment, supported employment, transportation, and pre-vocational services. Those are ones that are offered on both waivers. So key service differences, we're going to go a little bit more into detail. So as we discussed before, the SLS waiver is based on a financial budget. The DD waiver is based on unit caps. So there, if you are on SLS, you could do up to 6 days of day program a week, because that, that's a full amount that you could do if you had the space in your plan to do so. Whereas on DD, there is that unit cap of 4,800. And there's a question of, can this come out of the daily rate? Can you use the daily rate for residential to offset these costs? The answer is going to be no for DD, because there is just a set limit on units. So you wouldn't be able to use anything from the daily rate to get more day program. It's just going to be that finite limit for all individuals. Professional services like music therapy, hypnotherapy, massage therapy are only offered through the SLS waiver. Those are not covered on the DD waiver, as well as home and vehicle modifications and CNA services. Those are also on the SLS service, but through a residential agency, you do have access to a nurse and appropriate nursing care. It just wouldn't be through a long-term home health agency. It would now be through the residential agency. So it would be structured a bit differently, but for all medical needs, those will be met. Next slide. What does being a residential provider entail? So this is something that families often ask, especially if they've been providing care to their family member. They want to know, what added responsibilities am I now going to have now that I'm working with this other agency and not just meeting the needs of my family member? So the first thing you'll notice is you're going to have to do some onboarding with trainings, which medication administration is a big one. Although you've probably been administering medications for many years, they just want to have a blanket training for everyone to ensure that everyone has a baseline of skills so that there's no confusion on that piece. So just to confirm that you're on the same page about the safe way to administer medications. You'll also see CPR training. Some agencies have other trainings they'd also like you to take, but they will be assisting you with accessing those trainings. So there'll be instructions, either they provide them internally or they may work with another company that provides those trainings. So they're going to help you in that onboarding process. DD also asks for some documentation. So tracking the administration of medications to ensure that no doses are being missed, to ensure that things are being administered properly, or to track maybe reactions and side effects. We'll ask for that kind of tracking, and they'll support you with that, ensuring that your individual has physical every year. So we'll be checking in on doctor's appointments to make sure dentist is happening every year, all of those pieces that are necessary to maintain health. Behavior tracking is something you'll see on some plans, not every plan. You'll see that more so with folks who are receiving behavioral services, and that's a piece of their service with the behavior team, is to understand their behaviors and in part tracking them to ensure that they're receiving the best care and that progress is being made. So not all individuals will have that kind of behavior tracking because they may not have that component. They may not have that need in additional assistance. And then assessments. So there are assessments like life skills assessments and risk assessments that are done with an agency just to establish baselines and to see how things are changing over time. It also informs potentially the amount of supervision an individual needs. So an agency would assist you in those assessments and writing those reports. Those tend to be more so on an annual basis. So it's not something you would necessarily be doing every day, every week, every month. And then finally, a big difference is the Human Rights Committee. That's something you only work with when you're on the DD waiver. So if you are currently on SLS living with your family, they may have some house rules, some expectations about the way the home is run. One thing we've seen is families might lock up food at night to ensure that there's not overeating overnight when there's less supervision. So that is acceptable, and it's understood that that is intended for the safety of the individual in the home. And we wouldn't necessarily be stripping that restriction away, but we'd want to be tracking it. So the idea of the Human Rights Committee is to ensure that we are as far away from institutions as possible and maintaining people in the community in the freest way possible to maintain their safety. So when there is a restriction in the home, it is documented and it needs to be approved by the Human Rights Committee and is reviewed generally every 4 to 6 months, potentially annually. So they would just be checking in to ensure that, yes, this is still effective, it's appropriate, and it's the least restrictive thing we can do to maintain this person's safety, just to ensure that no one is being steamrolled and that everyone has the access to their rights. All psychotropic medications are considered a restriction, so those are just reviewed as well. So timeline for next steps. If you are being offered a spot on the DD waiver, this is where your ears should perk up because we want to give you some tools for next steps. So, pardon me, you have an opportunity to try out the DD waiver. It's not something that you have to commit to for life. Once you're on it, you can maintain it for the rest of your life. But if you decide it's not a good fit, you can return to your previous waiver. So that's something to keep in mind. The drawback with that is you may not be able to get back onto DD as easily. So that's the key difference. You could leave DD at any time, but to get onto DD is the struggle. So many folks are on a wait list and you may be listed as soon as available or safety net. So if you're as soon as available, if you're more likely to get offered a spot because you're saying, I'm ready to accept this. Whereas on safety net, you're saying it's maybe not the best fit for me right now. It's not something that's urgent, but I would like to be on the list as my needs change. So if you turn down the DD waiver and you were as soon as available, you're going to go to safety net because it's not something you are urgently needing. So keep that in mind as you make your decisions. You can try it out and leave, but the ability to come back is the tricky part. If you're ready to accept, I've been waiting for this for years, or all this sounds great, let's do it. First thing you'll do is contact your case manager. So this is if your case manager has already reached out to you and said, your number has come up, we have a spot open specifically for you, and you've come to this info session to get a better idea of what that means. If you feel that you're ready to move forward, you're going to give them a call and say, let's do this. From there, you're also going to provide information for your primary care physician, because we'll need to send them a document just to confirm your eligibility. This is something we've been previously doing every year, and luckily the state has allowed us to stop doing it every year and only do it with enrollments. So we want to get that information as soon as possible because we need it to complete the enrollment, and it often takes doctors' offices a little bit of time to confirm them just with how busy their schedules are. So the sooner we get that information, the sooner we get that document out. So it's not something we're waiting on. We don't want that to be a barrier to starting the waiver. Next, we want to ensure that there's funding for room and board. So if you receive Social Security, great. If you're employed and your income can cover it, excellent. If you don't have something set up right away, that doesn't mean you're not eligible, but it's a conversation we want to start having to ensure it's set up, because you can't get on the waiver and get moving if you don't have a way to pay monthly room and board. So that's a piece of the discussion we'd want to look into. We'd also like to be discussing, what's your ideal residential agency? What needs are most important to you in a team? What are your biggest concerns? Do you find that your individual has a lot of medical needs? So you want maybe an agency that has a lot of free access to nursing staff, or someone who's just really easy to contact and reach out to, or maybe someone that's a little more hands-off, that trusts your ability to do things. And as long as you're filling out the paperwork and doing the tracking, then you're good. It's really to meet your needs as a team. So we would start collecting that information, and we'd be sending out what's called a request for providers, which is an RFP, and it's going to include all of that basic information, needs, expectations, strengths, weaknesses, things that you'd want in there. And any of the agencies in the area that have openings and think that they would be a good fit will respond to the case manager. And from there, we can start setting up meet and greets. Once you've done meet and greets, you've figured out what daily rate works for you, which agency is the best fit, and have decided to move forward, we will set up an IP meeting for that enrollment. And that from there, you can invite other individuals, maybe other family members or day program staff, support and employment. Anyone who's already been a part of the team prior to the DD waiver would be welcome to join as you write the plan for this next year. So once that is set up, the case manager can process all that information and submit the enrollment packet, and you are ready to roll. So that is the synopsis. It takes a little bit longer than it does to just say a bulleted list. It is a process, but we wanted to just give you a heads up on this is a step-by-step we have set up to make it as smooth as possible. Next slide. All right, so now is the time for your questions. I covered a lot of information in record speed, so please let me know what you have jotted down and what questions you have. We're going to try to answer as many as we can. And for anything we don't have an answer on, we will follow up with you at a later time. And we also suggest if you have a specific question that really might be only applicable to your specific situation, that's when we'd want to loop in your case manager. But please utilize this tool to get as much information as possible first, and then let's contact the case manager later. Just keeping in mind that they have so many enrollments right now with this waiver change that we think we can best meet your need with information initially here. And then anything we can't work on, we'll have you go to your case manager after that. So we're a line of information first, and then you can feel free to contact them. But I'm not sure if there was one in the chat. If you would like to be unmuted, you can send a message in the chat, or if you're on a computer, check the bottom left-hand corner where it has a little picture of the microphone with a red line through it. If you click on it, it will unmute you and we'll all be able to hear your question.
I have a question. Did you get it?
Yep.
Can you get a copy of those wonderful slides?
Yes, we are going to be providing not only the PowerPoint, but we're going to give you a PDF of it written out as well with a lot of information. So you can click a heading and it will take you to the correct section. So yes, we will provide all of that because it's a lot to just take in. So we'll make sure you have a reference for a later date. Yes, absolutely. Yep, the PowerPoint will be, I believe, Kristen, correct me if I'm wrong, I believe we're going to make it accessible on the website so that you can download it at your leisure and view it anytime and save a copy. That way, even if someone wasn't able to attend today, they can access it. And we'll make sure to get you those instructions on how to access it.
Thank you.
I just had a question. Do we contact our case manager when we want to get this all going?
That sounds about this, the same thing.
If you've been offered, if you or a family member have been offered a slot recently for the DD waiver, if you're ready to move forward, you can contact them and let them know, and they'll get you started on that process with residential agencies, contacting the physician, getting an IP meeting scheduled. They're going to start facilitating all of that. If you have more questions and are not quite ready to pull the trigger on it, that's fine. You can engage with more of the resources that we put on the website. And then from there, if those still aren't meeting the needs of your questions, then you can contact your case manager to have a little info session of your own.
We don't have a case manager yet. We had one, but he left. So I'm not quite sure if we're kind of in limbo of one, or I know we talked to a manager. I don't think he was a specific case manager because he's the one that called us last week to let us know that we were off the list and that we accepted to go with the DD waiver.
Hi, that's me. So you can still contact me. There is a very new case manager that is assigned to the case, but since they're so new, please do contact me or I'll just follow up with you.
Okay, perfect. Thank you.
Excellent. And then I see a message in the chat that says, if a client is in an apartment with rent slightly above $800 per month.
That's what I am.
So yes, this is not, they might be doing the PCA model, which would mean they would remain in their apartment. And they would not have to move out. They would just receive services there. So potentially that could look like a provider coming on a weekly basis, whatever schedule they set up to provide services. as long as they can financially maintain that rent, yes, that should not be a barrier. So remind me, Kristen, is that where the room and board comes in? How do those work together?
So the residential agency is still going to take room and board, but they would just pay for that person's apartment. So it doesn't, it's a little different in that situation in that there's not a direct handoff from the person to the landlord necessarily, unless the residential agency comes in and they're like, things are good here, we don't need to mess it up by becoming the middleman. But there is a lot of times that residential person does come in and be the middleman between that person and their landlord. And yet Paul put a great note in there that residential agencies can cover costs above room and board based on their overhead limit. So we have seen previously that they've been able to cover costs of a more expensive apartment, you know, not crazy expensive, but more expensive than room and board, just to keep that person in their services.
And that's something you could absolutely discuss with agencies as you're searching, saying, this is our situation. Our individual likes to live here, would like to maintain this. Would this be a barrier to working with your agency? And they can tell you that upfront. So if you're ever, you know, 800, going to be easy to work with. If they're paying 1,700, that's going to be a different discussion entirely. So that would be something you would work directly with agencies to determine. But no, in general, should not be an issue.
And it's important to note too that, oh, sorry.
Well, go
I was
ahead.
just going to say it's important to note that none of these things have to be set in stone. So if you start with one model, like family caregiver, you don't have to do that forever. You could start as a family caregiver and then move somebody into a host home or a PCA type model. The residential agency doesn't have to be the same agency throughout the entire time that somebody's on the DD waiver. You can switch at any point in time. So there's a lot of flexibility throughout this process, and it doesn't have to be, we started this way, we have to keep it this way. You can always change.
Okay, yeah, I was wondering, do we keep the same case manager regardless of who the residential agency is?
Yes, great question. So the case manager would not change. They would be the person handling your enrollment. They're going to be processing the paperwork a little bit differently since it's a new waiver, but unless they leave, they're sticking with you. So that's the good news, is you have consistency through the process, unless there's something else that comes up and you want to request someone else. But for the most part, you will have consistency there. What will change on your team is that now you'll have extra team members through that residential agency, but you can still stay at the same day programs. Those pieces don't change unless the host home, for example, you might choose is really far away. Then you might be changing services to be closer, but nothing has to change if that's not going to work.
Okay, and is it possible to get references to talk to people that are working with different agencies? Because that's what I've had a hard time with, is getting information so that I can make an informed decision.
Sure. This is the trickier part, is interviewing and figuring out who's the right fit. I think that's definitely, you get a lot of information at once, and that's often the most time-consuming part of this process, is just finding the right team for you. So as case managers, we don't provide any references in terms of who we prefer or we don't, because we have to be conflict-free. One thing we do provide is when we send out that request for providers and agencies start to respond, we connect you with those agencies. They all have websites. And then during the meet and greet, that's when you really get to the bottom of it and say, what is it you can offer me that another agency can't? And how can you assure me that I'm getting the best rates here? Or if this is the kind of lifestyle we live, how will we be able to support that? You can really ask those specific questions in the meet and greets. And then it is a little bit of a leap of faith. You won't truly know until you're in the services. So we hope that through the meet and greet, you get the best information and feel you have enough information to make the decision. But like Kristen said, if a couple months down the road, you say, I really don't think this is the right fit, we send out another request for providers and you're able to start that process again and move. So you don't have with an agency if they're no longer meeting your needs. And then
yeah, I understand. I was wondering if you could get references from people receiving services in terms of how it's working for them.
Sure. I think that's something that we would love to have. I don't think we have a system currently that connects you with those. You can ask a company if they have any volunteers, if they have anyone that they could connect you with internally that would be willing to discuss. But other than that, I don't think we have a method of doing that because we can't give out personal information about who's receiving services.
Well, yeah, of course, yeah. And I mean, with their approval, but I
Sure.
understand.
So that might, I think the best avenue would potentially be asking the agency if they have anyone internally be willing
In
to.
the past, I've had agencies during the meet and greet offer to provide a few family names that they're, work with the agency as kind of that reference. I know a couple agencies just had those people kind of on hand, ready to kind of reach out to the family and have that discussion. Other agencies, you might need to ask for it and kind of be upfront about it. But I do know that is a thing.
Okay.
Yeah.
Thank you. I have one other question, and I hope it benefits other people. It's not just for me. And the other about the ease of reporting, of the paperwork, whether it's apps, whatever. Like it's been, just working with different programs with Imagine. It hasn't been easy. It's just been kind of a hassle, and things don't always work. I'm just wondering how it is with the DD waiver, in terms of how often do you report whatever needs to be reported and all of that.
Sure. That's a great question for meet and greets because agencies are flexible in their expectations. So some may ask for daily and some might say, I just need something at the end of the week. It really comes down to what their expectations are, but that's something you can also ask for flexibility on. To say with it in mind that this is time consuming, maybe this is something you only want to do Sunday night when you have time to just sit down and enter everything in. So at this time, there's not a set standard across the board for that reporting that I'm aware of. So you can certainly ask that question. And if there are barriers there, asking for assistance, if their system really isn't working, then they may need to provide you an alternative. Right. Any other questions? Anyone need help unmuting?
Well, I guess I have more questions if nobody else has questions.
Sure, we've got time.
Okay, great. So I'm wondering about, it seems that since I would be a family provider, and it seems that with the DD waiver, there is less services that are actually included because it's a whole different arrangement. Basically, I would pay, out of whatever the daily rate is for services, correct? When you had the two, the two circles with the overlapping, it wasn't clear to me who pays for what.
Sure. Yeah, that is a great question. So it depends on the service. Day program, supported employment, free vacation, those are all still covered with both waivers. But other things like massage therapy, hippotherapy, music therapy, for example, yes, would need to be funded separately, potentially through, the daily rate.
What about like emotional support, community access, things like that, homemaker things?
So some of those are wrapped into the residential service. So some of the homemaker assistance is provided through residential. And you would be compensated to access that, or you would use a daily rate. Even additional assistance, sometimes a residential agency would come in and assist with that. That's something you could discuss in a meet and greet.
Okay, because the homemaker, I was just talking with one of the residential agencies, and they said they don't provide that at all, even though I think what I heard you say was that it's included in the services.
It in part depends on which model you're utilizing. So homemaker is definitely wrapped into a host home. because they would be the provider in that situation. So if you're a family caregiver, you may be responsible for that piece or using the daily rate if you want an external provider to assist. If you were doing like the PCA model and you were staying as a caregiver, but were not a staff member, then I believe that a staff would come in and provide that. So you would be compensated for it because someone else would be providing it. So you would not receive the daily rate.
Okay, so if, well, see, being the family provider, and let's say I hire somebody for whatever, do I have to, do I pay them? Because I know that one's own income is not reported. It's not taxable. And so what about expenses of like driving the person around, grocery shopping, respite, sometimes things like that. Like, and if you pay for that out of pocket, is that deductible, or you just kind of write it off based on whatever daily rate you get? You figured, well, I have to spend $40 a day out of the $80 a day that I would get, something like that.
Yes, for the most part, that's how it would be structured. The daily rate is intended to cover those additional expenses. Respite is a little bit unique. So when you're on the DD waiver, the residential agency is responsible for assisting you with locating respite providers, and that daily rate would be used to pay them. So if you're not providing care, you wouldn't be receiving the daily rate for those days. That would be to the respite provider if it were a full day. A couple hours, that's structured a little differently. But these are great questions for an agency for how they structure that specifically.
I had a question about, the client living on their own. That's my daughter's goal. And, the $700 a month, it sounds very reasonable because apartment rates, I just looked up a couple of places, and it's very difficult to find an apartment for $700 a month. You're looking at $1,000 and up in Broomfield, similar in Lakewood. So how are clients negotiating that? And the waiver helping them with their goal to live independently in the community?
Great question. So the first part of that, as we know, that's a goal for many folks. For people who are not quite there yet to actually moving out on their own, they could choose another model and work towards that. So an agency would be supporting them with the intention of developing those skills to move out on their own. So they wouldn't have to accept the DD waiver and immediately go out on their own if they weren't ready. So that's one piece of it. We could so that we're working towards that goal. And then the other piece would be shopping around with agencies and saying, this is our intention. Here's the budget we're looking at. We find that a lot of residential agencies are helping to locate these apartments and then saying what is the budget, considering their support level, considering room and board, those pieces. So they can assist with that process.
A follow-up question. So I'm assuming the $700 a month is just rent, utilities and everything is additional, correct?
Room and board covers it. So room and board covers the rent, the utilities, also like groceries, all of those pieces is covered in the 700.
Okay. All right. Thank you.
If they're living on their own, they may also be utilizing, they have personal needs money that's often left over after if they're receiving Social Security or other money they may be using to buy other odds and ends. Again, the residential agency could assist with budgeting for that.
Okay.
It's realistic to live on their own and provide these other needs.
Okay, thank you.
All right. We have a couple more minutes for any last questions. Let's see. So if a client is currently living with family, is interested in living independently with the PCA model, how would they go about obtaining housing? Could residential help set that up? Or would that be up to the client? Great question. So if that is a goal And we feel that that's an attainable goal. For some people, that's more accessible than others based on their abilities and what they're working on. The residential agency would assist with obtaining that housing if they felt they could maintain that setting. So some agencies may say, we don't feel that at this time you could safely navigate living on your own. So if you're going to pursue that, you may need to look at another agencies. Oftentimes they're pretty upfront with, if this is your goal, we're actively working on this, here are what we need to see met before we really start to seriously look at other places, but they would be assisting with that transition. And as long as the individual and the family likes the way that that agency does the PCA model, they could stay with that agency. Or we could put out an RFP and say, we'd really like to see what else is out there for this different kind of setting. But yes, they would be part of the team helping to locate that separate housing. And often they have connections to apartment buildings or other community connections for housing. Not always, but we do have agencies that have a lot of community connections because they really specialize in PCA models. That might be something they really focus on. So they have more opportunities they can offer than other agencies who really more so do host homes. So I think this recording will be available as well. It sounds like we're going to try to save this and pull this up. So if you asked a specific question today, we provided an answer and you want to go back and review it, you should be able to do that on the website, and we can send out that information. So you're welcome to contact your case manager and say, hey, remind me how I get to it on the website. We haven't put it up yet. So I think by the end of the week, we're going to provide some instructions on where that would be located on the Imagine website. And the intention is to provide the video, the PowerPoint, and then also a PDF where we just really have a lot of details about each section. So even if there's something we didn't cover, hopefully we'll have it covered in that PDF. If you find that there's something outside of those questions, yeah, please reach out and contact your case manager and they can pass it along to us to cover in the next info session, and we'll connect you with the right information. Okay, well, thank you everyone for attending. I hope this was helpful. It is a very complex topic, so please feel free to come back and attend another info session or ask for more specific time, or whatever you need, please let us know, because we're trying to make this as comprehensive and accessible to everyone, because it is not an easy topic to discuss in just 1 hour. So I see some people are dropping some email contact information. If you have a case manager, I recommend going directly with them, to them for information. I am going to go ahead and save it to have it, but your case manager is your personal connection to the rest of Imagine. So just to ensure you have everything you need, please contact them first. Okay, well, thank you so much and have a wonderful day.